All right, so this is our rig. Health 99 is specifically focused on opioid response.
We have Narcan kits here. You can be safe and be vulnerable here, and that's what happens with a lot of our clients. Beanies and scarves.
It's typically me or another case manager, and we're paired with 2 firefighters. And what we're trying to do as a whole is really try to connect folks to the best services and programs that we can.
What makes this rig very special is this safe over here. And then we have firefighters specifically trained to access that and be able to distribute buprenorphine.
I started riding with that team about once a month, almost 2 years ago. And then an opportunity came for this program to start a pre-hospital buprenorphine pilot. It was a fantastic way for me to learn how that works and then also see how I could use my skills as a resident physician to support them in that new pilot.
She came in kind of right away as someone that was teaching us, advising us in terms of what is Suboxone, what does it do, when can you give it, and really just helping us with that framework.
Here's our paperwork for the buprenorphine.
The quality improvement I'm working on is to see at each step of care from that initial overdose through whether that's getting the buprenorphine, coming to the emergency department, or even going to an alternative destination where they can get ongoing resources. It's looking at who is falling through the cracks at each step and how can we triage and target our quality improvement to the areas where people might be falling through the cracks.
We've been able to make headway when it comes to best practices for even hospitals and clinics for when we're bringing folks to them. We are giving out, as a team, we're giving out pre-hospital bupe. I think we're around 80 or so, 100 between there. And our specific EMTs, we're about 47 since November. And we also have a follow-up unit now, which is huge, which is what Kira has kind of been helping to advocate for.
We know that buprenorphine stays in the body one dose for about 36 hours generally, and we know that it decreases mortality for people who are using it for opioid use disorder, overall mortality by 50%. This is a novel way to provide a life-saving medication and connection to life-saving resources.
This is huge, it's groundbreaking, so we have to keep advocating for what our clients are needing and telling us and not letting the policymakers make those decisions without their input.